Good evening, everybody. My name is Samir Mayakar, and I'm Deputy Mayor for Neighborhood and Economic Development at the City of Chicago. And I want to thank you all for taking time to join us tonight and welcome you here on behalf of Mayor Lightfoot. Tonight, we are having an essential worker town hall hosted by the city, and you're going to hear from a number of people on our team. This event will be presented in ASL, and we will be reposting shortly thereafter with a recording in Spanish as well. So we know that it's been a challenging year for all of us, but especially for our frontline essential workers who throughout this pandemic have continued to serve this great city. And this city runs because of you, and we wouldn't be where we are today without all of your hard work and commitment. So we are excited to have you join us tonight in this forum. It's an opportunity for you, the essential worker, to learn more about the COVID-19 vaccine and to learn when and where you can get the vaccine. This is also an opportunity for our team in the city to answer all of your questions. This evening, we're going to hear from Dr. Geraldine Luna, a medical director with the Chicago Department of Public Health. And we're also going to hear from Tamara Mahal, the city's head of vaccine operations. Throughout the presentation, please feel free to post your questions here in the Zoom chat, and we will make sure to collect your questions and then do our best to answer them during the course of this town hall. Now, before we get started, I wanted to show you a little bit about our strategy here in Chicago in terms of how we're thinking about tackling the challenge ahead of us in terms of vaccination. I want you to know that equity drives all the vaccine distribution philosophy here in the city. It's not just a part of our strategy, it is our strategy. We aim to be the largest city that most efficiently and equitably distributes the vaccine. And I really wanted to show you this data today because we are the only major city, especially a city of our size in the US, that is so focused on efficiency and equity. And the data really shows that that strategy is working. The city has enrolled vaccination sites in our hardest hit communities. And we've deployed vaccination strike teams prioritizing critical populations. We also launched the Protect Chicago Plus program with a dedicated vaccine supply and resources to the 15 neighborhoods that have been most burdened by the COVID-19 pandemic. And thanks to all these efforts, last week alone, over 55% of vaccine doses went to our Black and Latinx residents. You're going to hear more from Tamara Mahal about all of these efforts in tonight's presentation as soon as I get done. Now, where are we today? Thanks to everyone doing their part, wearing a mask, washing your hands, maintaining social distance, the current rate of COVID is at a low of 2.8% positivity. Over the last weeks, the mayor has announced a reopening of parks in the lakefront. We've increased indoor capacity of restaurants to 50%, and the opening day for Sox and Cubs will be up to 20% of stadium capacity. And as it starts to get warmer, we want to remind everyone to stay vigilant and safe, but we do hope to continue reopening. And as you see on the data here, over 15% of our residents have received a first dose. That's ahead of our big city peers like New York, LA, and Houston. And you'll see on an equity level how the data stacks up. Again, we are in a leading position, both in efficiency and equity. So we're going to kick off our town hall tonight by hearing from you, essential workers, about your experiences during COVID-19 and your feelings about the vaccine. I believe we have a few testimonials here that we would like to share.
When COVID first hit, as a bus operator, it was chaotic. It was chaotic. You didn't know exactly who had it, what had it. It's unknown, it's unseen.
As a letter carrier, we're out in the elements. We touch so many objects. Do you know how many doorknobs we touch a day? How many door handles we touch a day? So it was scary.
Once they started talking about vaccines, I followed the doctors and listening to what they said in the CDC reports. So it was more of an imperative thing that I get this vaccination, but it was more, I needed more information. Just because you say this is it, I need to follow the information for myself.
We had a meeting and there was a doctor that answered all type of questions for us. I think she was on the line for like an hour. And she educated us about it. You know, she made it seem as if it was safe to take. We didn't have anything to worry about. The side effects were low, and the stats of the vaccine. And I think it changed a lot of people's minds about actually getting. So yeah, and I just want this to be over with.
So, la razón por que me puse la vacuna fue porque quise yo protegerme, proteger a mi familia, a mis amigos, a mis compañeros de trabajo.
Once I started reading up on it and listening to it, the reviews of the doctors, I started feeling more and more incentive to get it for myself because I believe this was the best aspect for me and my family.
It was a big relief for me to get the first shot, and I'm looking forward to the second shot.
Thank you. Thank you a lot for that presentation. Testimonial was so powerful. And this is a situation that we have in a lot of our members, and we continue to do. Hesitancy is a big problem to get the vaccination. But here are the facts that are so necessary so we can make that choice to protect ourselves and to protect the people that we love. And by doing so, we protect our communities, we protect Chicago. Next slide, please. The COVID-19 vaccine is the most important tool to end this pandemic. Is a part of the process still. We will need to do extra things, the same mitigation measures that we've been doing so far. But believe me, to finish this pandemic, we really need to get that vaccine. We have to get everyone vaccinated. Is the only way we can go back to the way we used to be, to our normalcy, to hugging each other. Okay, and the question that we get a lot is the is the emergency use authorization process safe? That's a question that we get a lot, and that's the major reason for hesitancy right now, for people to understand that this vaccine might not be for them because it was too fast. Maybe some corners were cut. Maybe they jumped some faces. Maybe I'm being experimented with. I mean, they have done it in the past. What if it's not if it's not safe, Dr. Luna? What if it has microchip? What if it has cells, embryonic cells, fetal cells? What if it comes into my genome, it changed who I am? What if it becomes part, it makes me infertile? It goes back down to my generation as it becomes part of my DNA. But let me just tell you that the emergency use authorization process is safe. It was accelerated to a certain point because we are in the middle of a pandemic. We can't deny what it is. So it opened their doors. These pharmaceutical companies had to open the doors to collaborate among scientists from all over the world, people that look like you, people that look like me. So just to put a couple of elements into place, the first presentation of COVID-19, SARS-1, first came into the history of humanity in 2002. So if you look back, there's a lot of data of what COVID-19 is now, which is SARS-2. Another important aspect and factor to take into account is that this technology is safe. For example, 2 of our 3 vaccinations, they use messenger RNA, and I'll explain in just a second. And another one that just came out, Johnson & Johnson, uses another technology that is vectors. It's an attenuated virus vector that's incapable of getting us sick, but at the same time is capable of delivering information that is needed for us to mount an immune response. So with those 2 elements in place, technologies that have been, for example, dead vectors or attenuated vectors, viral vectors, have been since 1970 in the market, used for all kinds of vaccines that we have done safely and have delivered to the public. And these 2 other messenger RNAs that had been more than a decade there, people from all over the world collaborating with the development of the vaccination. And all the data since 2002, there is a safe process into it. There is a lot of science into it. And nobody cut corners. The scrutiny was the same. The rigorous process that we always have with medications that we're approving or vaccines, it was the same method over and over. So let's go to the next slide. Right now, we have 3 vaccines, amazing vaccines with incredible protection. We have Pfizer, we have Moderna, and now recently approved by the FDA, we have Johnson & Johnson, and recommended by the CDC and all their academic, national academic immunizations recommendations that supports the use of this vaccination within a framework of equity. I would have to echo what we already saying over and over. This was an equitable process, and I'll explain why. So Pfizer and Moderna had very robust representation. Pfizer had 43,262 individuals participating in the clinical trials, and Moderna 30,000, a little bit more. And Johnson & Johnson had 60,000 individuals. So we're talking altogether 100,000 participants with a great representation of Latino and African-American communities. So these are people that look like us, and it has proven to be safe. Pfizer and Moderna are protective up to 95 in the case of Pfizer, and Moderna 94.5. And then Johnson & Johnson, within 2 weeks of giving 1 dose of the vaccination, which is a huge difference from the previous 2, gives you a protection of 72%. And this is from getting the disease, symptoms from the disease. And after 28 days, this vaccination grows up in power and protects you over to 85%, all the way to 100% from if you get the COVID-19, which any of those vaccination protects you very highly, but there is always a chance you will not suffer from severe phases of the COVID-19, which is the killer, and hospitalizations related to COVID-19, and the worst of everything, the worst outcome. It protects you from dying from COVID-19. So all of them are equally powerful. You don't need to pick and choose between them. Whenever you have the chance to get your vaccine in the prioritization list, go get it. You're protecting yourself, you're protecting the ones that you love, and you're protecting your community as a whole. And then when we're thinking about the doses, Johnson & Johnson and Pfizer need 2 of those doses to be completely vaccinated, as opposed to our 3rd one, which Johnson & Johnson only requires 1. Remember, Pfizer and Moderna requires 2 to get fully vaccinated, Johnson & Johnson only 1. And next slide, please. So when we're looking at all these indicators, the great news is we have already vaccinated 3/4 million individuals here in Chicago safely. Nothing has been, no major events have been associated with any of our vaccines. Our vaccines are safe. And now the recommendations of CDC is a reason to celebrate even more. If fully vaccinated and you pertain to a household, like for example, grandma, which I haven't seen for over a year, so she gets vaccinated, she can go visit people that are vaccinated, like their grandchildren or their grown children of the household, fully vaccinated. She does not need to have preventative measures in place. No one there. They can celebrate, they can hug each other, they can be who we used to be without the masks, without any of our preventative measures. And if we have a family that is completely vaccinated, visiting, for example, grandma decides to vaccinate other grandchildren and their children, but none of them are vaccinated and they're pertain to a household, and no one there is a high risk of getting infected with COVID-19, like another grandparent living in there, they can go, again, celebrate each other without using preventative measures. They're not required. So these are the first things that we're gaining. But if we have a family that is completely vaccinated, again, grandma, go in visiting people that are not vaccinating, and then they have a grandparent in there living there. So then we need to use our preventative measures, the mitigation measures that we know that work, using masks, social distancing, ventilated areas, mainly washing our hands and keeping everything sanitized around us. And the same thing if we go in a gathering, grandma decides to go visit and 2 of their family get together, but no one is vaccinated, we still need to use preventative measures. So until everyone is vaccinated, everybody is, we cannot be who we used to be. Next slide, please. And I'll leave it out now to Tamara Mahal so she can give us the vaccine operation center and everything that has to do with that. Thank you.
Thank you, Dr. Luna. Hi, everyone. I'm Tamara Mahal. I am in charge of vaccine operations for the city of Chicago, making sure that we do have the most efficient and most equitable distribution in the country. If we go to the next slide, I just want to start by talking about where we are right now in the city of Chicago. And I just want to talk about who has received the vaccine so far. Now, when you look at the population on the right-hand side, this map is actually outdated. And what I want to do right now is actually talk about our progress a little bit, because as you see on the left-hand side, we have given first doses to over 440,000 Chicago residents. And one of the things that we noticed early on was that we wanted to make sure that we had an equitable distribution that took some of the light colors on this map and made sure that they turned darker blue in accordance with other areas of the city. And I'm happy to say that we've accomplished that through a variety of means. First things first, if you go to the next slide, I would just want to start by talking about who has received the vaccine so far. So at this point in time, 1 in 5 people that are one in 5 Chicagoans who are over the age of 18 have received at least 1 dose of the vaccine. And as you've probably heard, we have been prioritizing and ensuring that senior citizens have also been getting the vaccine. So people that are over the age of 65 years, 2 in 5 Chicagoans have thus far received the vaccine. Next. We are still in phase 1B. Now, a very exciting thing actually happened today where the Chicago Department of Public Health actually gave permission for healthcare providers to start, if they have already vaccinated, there's the patients that are over the age of 65, to start vaccinating people that are between the ages of 18 and 64, 16 and 64, depending on the vaccine type, that have underlying conditions. But we are very closely approaching another phase, which is when phase 1C opens here at the end of the month. Currently, our focus in terms of essential workers has been on frontline essential workers as defined by the CDC. That has included people like grocery store workers, daycare workers, people working in manufacturing and food production. And starting in phase 1C, we're going to be moving forward to continue vaccinating workers, especially those in things like warehousing and logistics, communications, media, IT, so on and so forth. And we do at this point in time intend to move on to that phase on March 29th. Now, what that means is that the eligibility will change for who can get a vaccine. But what I want to be really clear about is that our number one challenge continues and has been the supply of vaccine, because the city of Chicago is getting vaccine based on our population. And while we have increased in amounts, we're still only getting enough for about 8,000 doses a day. And when you consider just the population of 1B, which was about 750,000 people, we've really only gotten enough vaccine thus far to vaccinate about 50 or 60% of those folks. So even when we open up to 1C, we really need everyone to maintain their patience as we are working as hard as possible to ensure that we can get as much vaccine out into the community as possible. And I will note that every week, 95 to 100% of our vaccine does go out and it gets into arms. Next slide. So that doesn't answer the question that we get most often, though, which is where and how do I get the vaccine? Well, first things first, if you are an employee that qualified as either 1A or 1B, or perhaps you're a person with an underlying condition, the first thing we tell you is check with your healthcare provider. Many healthcare providers, we have 589 healthcare providers that are enrolled to get vaccine. Because of vaccine supply limitations, we've only been able to give vaccine to about 47% of those, but many healthcare providers in this city do have vaccine and are vaccinated on a weekly basis. You can also check, and you're eligible to get vaccinated at many of your local pharmacies. Walgreens, Mariano's, Walmart, Jewel Osco, and Costco are all vaccinating at this time if you can get an appointment. And I do want to note that for many people, you will have access to get a vaccine through your employer, either because we're sending out mobile teams to make sure that your organization is vaccinated, or because we're working with your employer to actually invite you in to a City of Chicago point of dispensing site. Now, another way that you can always look to see if you can get a vaccine appointment if you qualify at this time is to go to ZocDoc. ZocDoc is a website that we've partnered with to provide a centralized appointment scheduling system. And many healthcare providers have signed on to post their open appointments on ZocDoc. This is also where you can find appointments for places like United Center or City of Chicago point of dispensing sites, our vaccination sites. But I will note the most frustrating thing, and I am with you on this, we hear it every day, is just there are not enough appointments available for the number of people that want them. As I've said, we are dispensing, we are delivering every single dose that's coming into the city every week, and we are trying our hardest to get through all of the different essential workers that we're looking to support, but we know that it's still frustrating. Keep trying. We are getting more vaccine all the time. And our hope is to be able to just continuously increase the amount of appointments available through these different sources. Next slide. Let me talk just for a second about United Center because it has received a lot of attention and it is one of our primary places at this point in time where you can get vaccine. So we did launch United Center on March 9th as a soft launch and then fully launched on March 10th. And United Center is a partnership between the Federal Emergency Management Agency, the state of Illinois, Cook County, and the city of Chicago. We are getting a lot of doses dedicated to Chicago residents, primarily to support both people that are 65 plus, but also, as Deputy Mayor Myercar mentioned, as well as I've talked about, to ensure the equitable distribution of vaccine. So one of the ways that we're ensuring people get access to the site is by restricting a number of the appointments to the zip codes that you see there. If you live in one of those zip codes, you are eligible to be vaccinated. As I said, we're also posting we also are posting appointments on ZocDoc, and you can get appointments through our call center if you're in one of these zip codes or over the age of 65, and you're welcome to try and call and get an appointment. We're putting more and more appointments up all the time, and we do expect that the eligibility there will open up a little bit more, but on a daily basis, we are posting appointments on ZocDoc, so you just got to keep checking and seeing if we can get you there. Another way, though, if you go to the next slide, is through our Protect Chicago Plus program. So we created Protect Chicago Plus to ensure that the communities who have been the most burdened by COVID-19, either because they have a high COVID incidence rate, high hospitalization or death rate, or actually one of the major factors taken into account here was the number of essential workers living in these communities. We wanted to make sure that they would be able to get additional vaccine supply so that the vaccination rate of those communities would keep up with the rest of the city. And I'm happy to say that the vaccination rate in the communities we're actively working in is actually beating, in some cases, the rest of the city of Chicago, which is quite a feat and leading the nation. If you live in one of these communities, you are eligible to get the vaccine based on your residence. You can go and look for more information depending on the community that you live in, either on Facebook pages or by going to the city's website to learn more about different ways that you're able to access vaccines here. Next slide. I think overall, any of these sources, the best place to go and find out about where vaccine is by going to www.chicago.gov/COVID-vax. There, if you go to find a vaccine, you're going to see Vaccine Finder, which will show you pharmacy locations open across the city that are accepting appointments. It will link you to ZocDoc. If a loved one that you know is homebound and you need their assistance, go to the For Seniors page. You can sign up there. You'll also find information on United Center, on Protect Chicago Plus, on all of these different initiatives that we have. And we'd encourage you to continuously go back and check out the site as we're always posting new information in every effort to make sure that you have access to the information that you need about vaccines. Next.
Thanks, Tamara. We're now going to go through some Q&A. So if you have questions, please type them in here into the Zoom and we'll make sure to review them. I'm going to start with some of the more medical related questions and then we'll probably migrate on to some of the eligibility questions. So Dr. Luna, you're going to be up first. The first question is, do you recommend having a Tylenol or I suppose any type of other medication after having the shot?
Prophylactic use of any medication, it's contraindicated at this point. Likely when you get your vaccine, it takes hours until you start mounting that immune response. So probably if you had it at 9 o'clock in the morning, it's probably by the afternoon or later on, more than 8 hours apart from your prophylactic vaccine medication that you took, that it takes you to your start feeling sore. So the recommendation, and you don't even know if you're going to get sore. It is so like it's very related individually to every person that gets the vaccine as what side effects that they might get, or not even any of those side effects. So the recommendation is aggressive hydration the day before, the day off of, and the day after. And then if at the time that you took the vaccine later on in the day, you start getting any of those symptoms, side effects, headaches, a little bit of chills, maybe soreness at the site of injection, maybe sore muscles overall, maybe a little fatigue, maybe you get any of those, then you can take your Tylenol or any of the other medications, ibuprofen, or anyone that works for you in terms of taking care of the pain and maybe a little bit of fever if you develop any of those as part of it. But remember, the symptoms are mild, nothing that is too much. It should be the case. These are mild symptoms and they should disappear in a couple of days.
Thanks, Dr. Luna. Another follow-up question here is in regards to the differences between the vaccines. So someone's asked if they get the J&J vaccine, is it okay if they then get the double shot of the Pfizer Moderna or vice versa? What would you recommend there?
Now, all the vaccines that we're giving right now is equally as protective. Even though you might see like the 95 on a second shot for Pfizer and Moderna, and initially 72% protection from Johnson & Johnson from the very single dose 14 days after. All of them, remember, you get the maximum protection after the second dose of the previous two, Pfizer and Moderna. And from J&J, you start getting the protection after 14 days. So remember that all of them progress. The protection progresses, and it covers for all the variants of COVID-19. And right now it covers from getting the disease and most importantly, dying from the disease if you ever get those disease. So presentations requiring hospitalization, severe phases of disease or dying from them is the part that you get the highest protection, and also from getting the disease yourself. So it's important that no need to pick and choose at this point. They're all as good as they come, and they're very, very powerful in terms of protection.
Thank you. Another question is in regards to side effects for someone who might have already had a case of COVID-19. So would you expect any different reaction to the vaccines, either the first or second dose, if you've already experienced COVID-19?
Yeah, we have received it's a very variable side effects or any of the symptoms if you ever get one. So we have heard all different case scenarios. For example, I have heard, doctor, when I suffer my COVID-19, which we know the natural immunization is not as protective as when you get the vaccine. So our recommendation is, even though you had the COVID-19 and successfully, you got over and recuperated, that natural protection is not enough. So getting vaccinated is very important. And if you got any of these vaccines, you will notice that the experience of every individual is so personal. So we don't know what kind of symptoms or the severity of those symptoms. We know they're mild symptoms when you compare them with getting sick with COVID-19, especially in the severe phases. So I wouldn't dare to say, hey, you're going to get worse. You're going to get, if you were vaccinated, if you had COVID, it's going to be worse, because we have had all type of experiences. So the most important thing is to get vaccinated, and those mild symptoms should not get in your way to getting your life-saving vaccine.
So the next question, Dr. Luna, is about the workplace. If all employees in a workplace are fully vaccinated, do they still need to wear a mask in the workplace?
So in congregated settings, because when you're working, there's a lot of people in that place, still CDC is recommending, until we get herd immunization from all the community, to wear your masks. But the new recommendations, if you're visiting one household, everything changes if you're immunized. If you're celebrating with a small group of individuals, everybody is immunized, you can go and celebrate without watching for mitigation preventions, which is using your mask, social distancing, or washing your hands continuously. You can be the old self that we used to be and celebrate each other. However, still in the working place, the recommendation so far is use your mask, social distancing, washing your hands frequently, and avoid going into and out of houses that are not your primary household or receiving visitations from anybody that is not from your immediate household.
Okay, two more clinical related questions here. Do people get tested for COVID before taking the vaccine, Dr. Luna?
There is no requirement to getting testing. It is irrelevant if you had COVID previously or not. But the important thing is if you're suffering an active disease, like let's say I have my active COVID right now, I'm feeling like the worst, I'm under the weather, that is not the best time to get the vaccine. The recommendations is waiting 10 to 14 days after recuperating and being your old self before you get the vaccine. Remember, getting the vaccine will challenge a little bit your reserves because you're mounting an immune response to create antibodies that are going to be your protection against COVID-19.
And then can you be an asymptomatic carrier if you're vaccinated? And how long does the protection from the vaccine last?
Well, that is a great question because we don't know for sure. And clinical trials were able to prove the protection to a certain extent. For example, when they were checking indicators such as getting the symptoms from the disease or getting suffering from severe manifestation of the disease, the severe phase of COVID-19 or hospitalizations or death, we don't know for sure. And that is the important thing is that while you're vaccinated and nobody else is vaccinated around you, you use your protections, your preventative that works, masking, social distancing, washing your hands with frequency. And then there was another question that you asked me, but
about how long the vaccine protection lasts, and that was the other question.
well, so far the clinical trials are now getting to 1 year after the initial inoculation with the vaccine. So it seems that the protection has continued even more than 1 year. So how much would it be, or if we need boosters, we still don't know. And it has a lot to do with different variants coming into our environment. So right now, the vaccine covers for all the variants that we have. So those are excellent news.
Great, thank you. So now, Tamara, I'm going to bring you into this discussion as well. This is for either of you. Do people get to choose which of the 3 available vaccines they receive?
Well, there are ways to choose, a lot of which is dependent on where you choose to go get a vaccine. The city of Chicago does have certain sites that are only set up for Johnson & Johnson, like our O'Hare Airport site. We also have sites that are set up for Pfizer. Most of the time, if you're going to get a vaccine from a healthcare provider, especially an outpatient provider, you're going to be getting Moderna at this point in time. I think if that's really important to you, that's something that you should ask your provider prior to your appointment. But I think as Dr. Luna has made very clear, all of these vaccines are effective and all of these vaccines will protect you. And take your shot to get a vaccine, no matter what kind of vaccine it is, because we're still at the point where demand is greatly exceeding supply. And you want to make sure you can take advantage to get your shot when you've got it.
Now we're going to move into a lot of eligibility questions. So I'm going to try and do my best here of aggregating them. I think there's a big question here about the hospitality sector, specifically individuals who work at restaurants or bars, and also in hotels, if they are eligible under 1C.
The answer is yes, you are eligible under 1C as essential workers. And we're hoping to have more information out specifically about who's included and also how you can get access to vaccine. I will note, no matter whether you're eligible if you're eligible in 1C, remember that as we open up on March 29th, we're still not going to have the amount of supply that we need to address the demand. So we're going to work as hard as possible to get access to the vaccine, but it may take a little bit to get an appointment.
In a similar vein, if someone worked in those sectors but is currently unemployed because they've been laid off due to COVID, do they fall within the eligibility of that sector?
This is a tough question, and I just want to say that I know this has been such a tough year for so many people living and working in Chicago, having to have experienced job loss as a result of everything going on with the pandemic. At this point in time, a lot of the focus is on people who are being exposed because of their work environment. So as a result, we are prioritizing people who are currently working in these fields, but that doesn't mean that there's not going to be opportunity for everyone to get vaccinated, especially as we open up more to all adults come the May timeframe.
Great. The next question is, how does an employer request vaccine at a specific workplace, and what credentials are needed for 1C workers to receive a vaccine?
Great questions. So for an employer to request vaccine, a couple different things. The first is, I would strongly encourage any employers that are on this call, go to chicago.gov/COVID-vax. And if you go to the section that says for employers, we have a plethora of information on there about how you can access vaccine. Right now, the primary ways are to, one, find a healthcare provider that will support your particular organization. Right now, because of the lack of third-party providers, so these are folks like pharmacies that you might typically invite out for a flu vaccine clinic. Because of the shortage of them, it's pretty difficult right now for people with under 1,000 or 500 employees to be able to have a pharmacy or other third-party provider come and vaccinate your employees. The city of Chicago is actually working with several healthcare organizations to provide what we call strike teams or mobile teams that actually go out to employers, especially in sectors we're concerned about or who have an outbreak history. So if that's the case and your organization has been identified as one of those, as we get closer to the 1C timeframe, you'll receive a reach out from the city of Chicago. That being said, there is a survey posted on our website that any employer can fill out in 1B or 1C to indicate that they need assistance getting their employees vaccinated. And we utilize that information to actually invite you and your employees in to be vaccinated at a City of Chicago vaccination site. So please go to our website, complete that survey. And I will say, please bear in mind, it's taking us several weeks sometimes to reach out, but we do commit to ensuring that you have contact so that we can let you know when and where to get vaccine.
There's a number of questions here about, am I eligible in a certain sector? Now we'll go through some of those questions, but generally, Tamara, where can people go on our site to check all the sub-industries of eligibility?
So right now, you're not going to find sub-industries of eligibility for phase 1C. I'll be honest with all of you, for phase 1B, please go to our website. It's actually on the front page, but you can also find it under for employees, where it will go through the 1B sub-prioritization. So why isn't up there for 1C? Well, it's a really good question. First things first, the city of Chicago is committed to following the U.S. Centers for Disease Control and Prevention's ACIP. That's a community, that's a special committee that looks at these issues. And they have actually not technically sub-prioritized 1C yet. So we're waiting for some further guidance from them, as well as waiting for our partners at the state of Illinois to work with them to determine what that 1C sub-prioritization is going to look like. Rest assured, our medical directors are talking all the time. We are looking very closely at this issue, not only to say who's eligible and what that prioritization is going to look like, but also to make sure that we're ready operationally to be out there and supporting. We're already working through partnerships with labor. We're setting up more locations. We're looking at this because we do believe we're going to get an influx of vaccine. And we want to make sure that not only can we provide you the information on where you've been prioritized, but also we can answer some of that critical question of, well, then where am I actually supposed to get vaccine? So stay tuned and more to come.
Thank you, Tamara. Another question on eligibility. If someone works in the city, but lives outside of the city, but is in an eligible industry, are they eligible to get a vaccine in the city?
At this time, the city of Chicago has informed healthcare providers that they can vaccinate anyone who lives, works, or receives healthcare here in the city of Chicago.
Thank you. Next question is, if someone is disabled but does not live in a priority zip code, will they receive a priority at any of the vaccine sites?
Okay, so first things first, people with underlying conditions who fall into, for lack of a better term, the 1B plus categorization as the state has identified it, are now eligible to be vaccinated through their healthcare providers. So we actually have sent messaging out to healthcare providers, encouraging them to schedule appointments for people with underlying conditions, including people with disabilities. We have prioritized and set aside a number of, in fact, a rather large number of slots at United Centers specifically for people with disabilities. And we're working with the mayor's office on people with disabilities in order to fill those slots as well. And at our other point of dispensing sites at this point in time, we are not actually serving the 1B plus population. We're still working through essential workers, but as we open up, I do believe that we'll be seeing a little bit more prioritization there as well. If you know someone who may have a disability and is not able to leave the home, again, we are working to get into homes and vaccinate people who meet that definition, and that information can also be found on our website.
Thanks, Tamara. Now back to you, Dr. Luna, a couple of medical questions here. What is the wait time between shot 1 and 2 for Pfizer and Moderna?
For Pfizer is 21 days, but even if you don't get it, because we know that supply is very limited and you might take a little longer, it doesn't matter. Once it's here, like 1 week after the 21st day or 2 weeks after, is as good as within the window. We always try to keep everything within the recommendations of the CDC to have everybody getting their vaccines for Pfizer 3 weeks later. And for Moderna, the same thing, but 28. So it's pretty much 4 weeks later.
And in terms of underlying conditions, if someone has asthma, I have asthma. So if I were to take the vaccine, am I at a greater risk of taking the vaccine?
If you're at greater risk of suffering for COVID after taking the vaccine?
If I have an underlying condition like asthma, does that place me in a different risk category from taking the vaccine? Will the vaccine impact my health?
Yes, a vaccine is more helpful if the more conditions you have, the higher risk of getting COVID-19, the more protected you are and by getting those vaccines. Especially anybody with any kind of conditions, chronic conditions that may place your reserves at some point compromise your immune systems or compromise your reserves should get those vaccines right now. And that's the way we've been doing our prioritization list, making sure that those that need it the first get it first.
And another question for you, Dr. Luna, can you talk about children? So there have been some questions about children under the age of 18, even infants, and when they could get vaccinated.
Well, yeah, Pfizer has proven in their clinical trials they included 16 years and older. Fortunately, all the other vaccines is 18 years and older. Pfizer has promised that they will give us some information about clinical trials in children. So we're waiting anxiously to see if it's going to be protected or not. Because if it's not, based on that, it's the recommendations that we will have people getting vaccinated for children 16 years and younger.
Thank you. Back to you, Tamara. Some questions about O'Hare. A lot of questions around that site, who it's open to, and how you can make an appointment there.
O'Hare is open to anyone currently working at the airports, as well as other public transit workers. If you go to prism.com/O'Hare, you can pre-register and you'll be invited in for an appointment based on your prioritization.
Thank you. I'm scrolling here. Now, there's a lot of specific questions. Let me get to one high-level question here. President Biden indicated that by May 1st, there will be enough vaccines for all Americans who wish to receive one. Does this mean that the city of Chicago is on schedule to vaccinate folks starting May 1st to open up eligibility?
We were really excited when President Biden came out and said that. I will note we have not yet seen that vaccine supply pick up. We're told that sometime in April, that's going to be what occurs. What I'll say is the city of Chicago is working very hard right now to prepare for when that time comes. What we want to make sure is that when that vaccine supply is delivered, that we're ready to actually push it out on a weekly basis like we're doing right now and get 100% of that vaccine into arms. So while I can't speak to whether or not we'll have the vaccine in hand, because we don't yet have it, what I do know is we're going to be ready for when it gets here so that we can get people vaccinated as quickly as possible.
Now, some questions around logistically how to actually sign up. So if you're eligible in 1C, when do you start checking for appointments? And are you going to healthcare providers or pharmacies or ZocDoc?
I'd say go where you can get an appointment, but what you're not going to be able to do is get an appointment until March 29th, most likely, because healthcare providers right now are working on vaccinating people with underlying conditions. So if you fall into that category, you're welcome to reach out to your healthcare provider and ask when they might have appointments available and when you should search. Like I said, we're already posting appointments every day on ZocDoc or many other medical providers, both for people that still qualify in 1B as well as people with underlying conditions. And I will note that on March 29th, in terms of appointments for the City of Chicago sites, we will then on March 29th open up many more appointments for the 1C workers. Now, what I do want to make clear is that if you are a worker in 1B and you have been a little hesitant to go and get your vaccine and you can get an appointment now, please get it, because the world's about to get a lot bigger on March 29th. That doesn't mean we're forgetting about our 1B folks. We're still vaccinating 1A folks, but we do just want to make sure that you're taking the opportunity now, because when 1C hits, we're going to add a lot of people to that eligibility pool. Fortunately, from what we're hearing from our federal resources, we will be going up in vaccine supply. And like I said, we're preparing for that as well.
So moving to a question on Protect Chicago Plus. So if you don't live in one of those neighborhoods, but you work in one of those neighborhoods, are you eligible to get vaccinated at one of the Protect Chicago Plus sites?
No, you are not. And the reason for that is that the Protect Chicago Plus communities were developed based on the Chicago Department of Public Health COVID Community Vulnerability Index. And that is actually based on residential area. What that means is that the people living in those communities have a substantially higher risk of having a higher COVID burden. And that is what we are attempting to address through Protect Chicago Plus. That being said, the city has prioritized vaccine to employers that work within those communities, knowing that there's a high number of people who live there. And as a result, many essential workers that work in those communities but don't live there have also been vaccinated.
Now, in terms of employers, a number of questions have come in saying that their employer has registered to have an on-site vaccination. They haven't heard back from the city. Could you maybe address when you think they would hear back, and if anyone wants to kind of inquire again, where they should do so?
Absolutely. So if your employer inquired at the city and they got ahead of the game and they're in 1C, but they filled out a survey anyway, that doesn't mean we've forgotten about you. We've just been working through the 1B essential workers, right? So continue to be patient. We are going to be working through here pretty quickly in the next 2 weeks to start addressing some of those 1C surveys. Again, I'd remind you, if your employer has not already done that, feel free to go and check that out. I will note that by completing that survey, you're not indicating that you're going to get a vaccine team to come to your organization. You're actually indicating that you would like for your employees to be invited into a City of Chicago vaccination site. But I would say, please maintain some patience. We're working as fast as we can, given our limited supply, and we are filling up all of our spots every week, but continue to invite employers in every day.
Thanks. I think we've got time for just 2 or 3 more questions here before we wrap up. Dr. Luna, can you drive yourself home after having the shot? Do you need someone to drive you home, like after you have a outpatient procedure?
No, you can drive yourself home safely. We give the protocol. Our protocol is 15 minutes observation after you get your vaccine. And if you have a history of allergies, food allergies, medication allergies, our time frame is a little bit longer. Once you're out of the woods in terms of the amount of time that we observe you at the clinic or at the pharmacy or any of the city pots, you're free to go. There is no other indication for you to get extra support to get home.
Great, thank you. And our last question here is this being recorded, and what will the follow-up be if we didn't get to the questions? We are recording all the questions here. We will make sure that we follow up with that information. And this is being recorded so that it can be sent around to share later on. And with that, knowing that we're about at time here, I want to say thank you to Dr. Luna. I want to say thank you to Tamara. These are public servants who are working very hard to make sure we are efficiently and equitably distributing the vaccine. And I'd like to thank all of you for attending. This has been an incredibly difficult year. The light is at the end of the tunnel, as the mayor likes to say. And so we wish you all the best as you partner with us to try and get these vaccines distributed efficiently and equitably. And please stay safe and healthy, everyone. Thank you so much, and we hope you have a nice night.